South Korea has issued a return-to-work order for private practitioners as more doctors join a prolonged strike against the government's plans to reform the healthcare system. Well, the call for doctors to return to clinics and hospitals comes as the country's largest doctors' organization, the Korean Medical Association, stage a one-day walkout to support striking trainees. More than 1,400 private clinics and professors from 40 medical schools have joined the collective action, which President Yoon Suk-yeol describes as regretful and disappointing.
정부는 전공의들을, 이 땅의 모든 의사들을 노예가 아니라 생명을 살리는 전문가로 존중하고 전문가의 목소리에 귀를 기울여야 합니다.
President Yoon said his administration will take all necessary measures to ensure protesting junior doctors and medical students can continue their studies and training. He warned, though, that the government has no choice but to respond to ongoing walkouts that neglect the pain and suffering of patients. Authorities previously issued the same order to striking trainee doctors before withdrawing it earlier this month as an olive branch. Under the law, those who defy the order can face suspension of their licenses, among other legal repercussions. CNA's Lim Yeon-suk tells us that despite the growing labor action, public support is behind the government's plan to increase the number of doctors.
South Korea has seen rallies and strikes by its doctors in the past. They usually go back to their jobs after making their voices heard. But it's been 4 months since more than 9,000 junior and trainee doctors left the hospitals over the government's plans to sharply increase medical school admissions. And now other doctors are taking action. Members of the Korean Medical Association, including doctors across South Korea, will go on strike on June 18th to protest government's healthcare reform. A vote was taken earlier, and about 74% of the members approved the collective action.
우리 후배인 전공의 의대생들이 시작하고 유지해 온 투쟁이지만 이제는 의협을 중심으로 선배 의사들이 이 사태를 바로 잡아야 합니다. 더 이상 끌 수 없는 상황입니다.
Speaking to CNA, KMA's deputy spokesman Choi Dong-young says the one-day strike could be just the beginning.
지금 저희가 말씀드린 건 일단은 18일 하루 휴진이지만 그 휴진을 시작으로 저희가 정부가 뭔가 대화에 전혀 의지가 없고 앞으로도 바뀔 그런 계획이 없으면 전공의 선생님들이 들어올 이유가 없기 때문에 저희는 앞으로도 투쟁을 이어나갈 거고 그 형태는 지금보다 수위를 더 올리는 형태로 아마 진행이 될 것 같습니다.
Doctors argue that the government's plan to increase the number of medical students will not solve the fundamental problems facing the healthcare system. These include a lack of specialists in some fields like pediatrics, where conditions and pay are poor compared to other specialists. The walkout by the junior and trainee doctors has crippled South Korean hospitals. Medical students have also either delayed their enrollment or boycotted classes in support with the junior doctors, saying the government's plan, if it goes ahead, will affect their careers as doctors once they graduate. Ashley Kim, who graduated from a nursing school in February, says she was offered a job as a nurse at one of South Korea's largest hospitals. But the hospital has not told her when to start, as hospitals are delaying new hires due to the ongoing walkout by doctors.
저는 작년에 합격을 한 상태인데 지금 의사 파업과 여러 가지 이유로 계속 입사가 미뤄지고 있는 상황이에요. 놀 때는 약간 좋았는데 이게 계속 언제 들어갈지 모르는 상황에서 있다 보니까 계속 초조하고.
She is hoping that the doctors will return to work soon because their job, like for nurses, is to treat patients. That sentiment is shared by the majority of South Koreans, who also say more doctors are needed in the country. Lim Yeon-suk, CNA, Seoul.
For more analysis, let's speak with Soon-man Kwon. He's Professor of Health Economics and Policy at Seoul National University. Well, thanks, Professor, for joining us this evening. So it appears that the Korean Medical Association remains defiant. Why exactly, Professor? I mean, are they emboldened by the fact that President Yoon's approval rating has been rather dismal?
Yeah, initially, all these struggles began initiated by the trainee doctors who left their, teaching hospitals. And then Korean Medical Association, he wants to kind of utilize this situation. However, until very recently, those professors at medical school or senior physicians in the tertiary care hospitals or teaching hospitals, they were not really had the same voice with the Korean Medical Association. However, as these strikes or workouts takes longer than expected, there is a criticism among medical community, criticism on the professors or senior doctors in tertiary care hospitals. So in a sense, finally, contrary to the previous trend, recently those senior doctors had the same voice with the Korean Medical Association. In a sense, they feel obliged to listen to the voices of trainee doctors, and they feel obliged to kind of block the government attempt to, have some kind of a penalty on those resident or trainee doctors who left those hospitals. So that's why recently, contrary to the initial expectations, I think today, for example, there is a strikes with inclusion participation of not only the KMA traditional members, but also some support from those senior doctors in tertiary care hospitals.
So it's interesting you've mentioned that, now the senior doctors, there's a sort of a slight change in their approach. But I want to pick up on Yoon Suk's story that we heard earlier, where KMA's deputy spokesperson says that this one-day strike could be just the beginning. So, Professor, then what do you make of it? Do we expect, more of the protests to escalate? And then what would be the government's next move if that happens?
Well, it's hard to predict. For example, from a KMA's perspectives, I'm not sure whether they can continue to this type of strikes because, as you know, Korean healthcare system is basically market-based system, and the physicians are paid by so-called fee for service, which means as you provide more services, as you treat more patients, you get more income. So that means if the doctors, if they close the office and participate in these strikes, it means a direct impact on their revenues. So contrary to the KMA's supposition, the participation rate in this type of KMA-led strike may not be as high as they say, or may not take long, as KMA says. And also for those professors or senior doctors in tertiary care hospitals, they usually treat a very severe patients. So when they do not treat, when they do not see patients, kind of societal level criticism on those doctors in tertiary care hospitals are very severe. So even if the senior doctors say that they will participate, they will go along with these KMA strikes, not only for one day, but maybe even forever, but they may not be that easy, I guess.
Yeah, and Professor, actually, we just got some news in saying that the KMA has actually threatened indefinite walkout from June 27th. I guess essentially giving the government some time to hash out something. Is that something that you foresee?
Yeah, that's what I'm saying. The KMA and also the kind of association or representatives of those senior doctors in tertiary care hospitals, they provide like 3 or 4 questions or big conditions, and they ask the government to answer. And if government answer, and if government is willing to change the policies regarding those 3 or 4 key areas, they are willing to give up the strikes. But those 3 or 4 key areas or suggestions it's quite difficult for the government to accept. For example, one of those key propositions from the KMA or Medical Society is the government should withdraw all possible penalties for all trainee doctors who walked away, regardless of whether they come back or not. So for the government position, they say, they are willing to withdraw any type of penalty for those who come back, but they cannot do that for those who do not want to come back to hospitals. And also another very important point is that the medical society request the government to entirely reverse the government policy on the increase in supply of doctors, and then they start from ground zero to talk about discuss again from the ground zero on the supply of doctors. But as you know, I mean, even the next year's medical school admissions, not just medical school, but university admissions, they all finalized and announced by the Ministry of Education. So at this point, if Ministry of Education or the government reverse the whole admissions for example, next year's medical school admissions, it might be a huge, disaster for those who are preparing for the university next year.
Yeah, and Professor, but the fact of it as well is that the majority of South Koreans themselves, they feel that more doctors are needed. So to what extent does public sentiment influence the policy decisions in South Korea, and do they even play a role in resolving this particular dispute?
So this is kind of a bit rare situation where not only, two political parties are both supporting this policy, and also about 80% of the Korean public support this policy. Maybe that's why, in a sense, government still had a strong position against medical society. And because in the previous 3 or 4 histories of the petition strikes, government usually gave up after a few days. But this time, based on this huge public support for the increase in medical doctors, the government still keeps a strong position. But I think this is a bit too much, because even myself, I support the increase in the medical doctors, but suddenly increase the medical doctors by 2,000 or 1,500 per year for every 5 years. That is a bit too much drastic change. So I think government needs to, although public support the increase, but the support for the exact number of this large number of medical doctors, that's a bit too much. So government needs to slightly change its position and should show the willingness to talk with the medical community. Because if this strikes takes too long, the public sentiment may change.
I hear what you're saying, Professor, and it's very interesting. You're saying that the jump is too drastic. So what do you think would be a happy number then, you think, that could possibly, compromise the situation between the doctors and the government?
Well, it's not easy, but for example, the Korean Medical Association, their position is very strong so far. They say that they don't need any increase in the number of doctors, whereas at least many of those professors or senior doctors in tertiary hospital, they support the increase in the number of doctors supplied, but not at this large number. So probably, there are some discussions, but in the range of around 1,000 or slightly less than 1,000 might be more reasonable. But still, in order to agree on the number, those stakeholders, not only government, medical doctors, but also more importantly, the public, all the stakeholders should sit down and talk to agree on the numbers. But government had been stick to the 2,000 for too long.
Okay, so looking perhaps maybe for the government to, bend that number to perhaps 1,000. But just very quickly, because you're the expert in health policy, what are some of the other alternative solutions that you think that the government and the Doctors Association can explore, aside from dropping possibly this number?
Well, another issue, I think, although not as important as the size of the supply, but another very important issue is how to ensure that inequity in the distribution of doctors in different locality, like urban versus rural, and also across different specialties. Some specialties are more lucrative compared to others. So even if we increase the number of doctors, this kind of inequity in the distribution, regional distribution, and cross-specialty distribution cannot be solved automatically. However, it is very clear that the increase in the supply of numbers, if we do not solve this problem, those inequity issues can never be solved. So if I can make myself clear, this increase in the supply cannot automatically guarantee to solve the inequity issues, but without increasing the supply of medical doctors, the inequity issue can never be solved. So in a sense, in addition to the increase in the supply of doctors, the government or expert or civil society or medical community should also have a big discussion how to improve these inequity issues in the Korean society, in the medical sector.
Well, you've made some really clear, poignant points there. Thanks so very much for your time and thoughts, Sonran Kwon, Professor of Health Economics and Policy from Seoul National University.